Now let's get an expert opinion on how Africa is faring and what it needs to do differently. Riva Levinson is a political and business strategist who has worked closely with some African leaders. She joins me live from Washington, D.C. Riva, thank you for joining us on TVC News at 10. Let's begin with the need for Africa to adopt a unique approach to fight the COVID-19 crisis. You have worked in sub-Saharan Africa, especially in Liberia. And you know just how difficult it is for many countries on the continent to survive a prolonged lockdown. Ghana, as we speak, has relaxed its restriction of movement. The United States, where you are, is considering the controversial reopening of the economy. Do you think there are practical ways African countries can follow this path?
So, first of all, thank you for having me. And I came to your attention because I wrote a particular column, as you know, in The Hill, where I talked about how Africa has the experience in fighting the virus, whether it's HIV/AIDS, whether it's Ebola in 2014. So there's unique capabilities within Africa society, and I heard you talk about that a bit in the news reporting. But those unique capabilities also have to be matched with significant resources in testing, in liquidity in the market, and in organization. So that was the main thesis that I put in my article with respect to Africa's unique circumstances. I think that's really an individual decision by the country in terms of prolonged lockdown or releasing, like you said, in Ghana. Liberia is in a lockdown as well. I think it really is the decision of the community what's going to be best to build the capacity of trust between government and community.
Since that article you mentioned was published sometime in March, quite a lot has changed in Africa. For instance, the figures have increased from 4,000 plus cases to well over 25,000 today and 1,000 plus deaths. How well would you say Africa has fared thus far? And comparing these recent figures with that of Europe and America, do you still think the continent urgently needs foreign help?
I do. I mean, I do, because it's the scope of the healthcare services that are available across Africa. The column that I wrote was a bit of a scavenger hunt because I went through Liberia trying to find ventilators, how many ventilators were in the country. And I found that there were 3, and none of them were in the public health system. So I realized at that point that Africa was going to have to use very different ways to be able to prevent the disease from community spread, because if it hit the healthcare systems, those healthcare systems would collapse. Early on, like you said, when I was in Liberia on 9 March, there were no cases. There were only a dozen cases across the continent. We've totally changed, and we've hit community spread. So then the question is, with all of those unique capacities that Africa has for whether it's a civil society mobilization or community mobilization or disease fighting, how do you put them in place? Ghana's made a unique decision. It's made a decision that it has the capability to test, contain, and treat while allowing some of the economy